live here. Uh, I'm Dr. Cave, a Stanford and Harvard trained, board certified anesthesiologist, integrative medicine specialist, and the medical director of a ketamine infusion clinic in San Francisco. And I'm thrilled to have Chris on as a guest for our live stream today. Chris, can you give us a quick intro about why you're on here and what we're going to learn from you?
Yeah. Hi,
Hi
guys.
guys.
My name is
My name is
Chris. I
Chris.
am
I am
from the
from
East
the East
Coast.
Coast,
And
and
to be
to be
honest, I'm
honest, I'm
trying
trying
to just
to
kind of
just kind of
follow the
follow the
doctor's leads.
doctor's
I have a
leads. I
lot
have a
of
lot of
medical trauma that
trauma
I
that I
endured.
endured.
Um,
Um,
so I'm just
so
going
I'm
to
just gonna
kind of
kind of
explain, if I
explain, if I
can,
can,
um, what happened
what
to me
happened to me
and how it
and how it
affected me
affected me
ongoing, and
ongoing,
it
and
affects
it
my
affects
everyday
my everyday
life.
life. And I don't want to interrupt you, Chris, but I just want to thank you for your vulnerability in sharing what's happened to you. I do understand that you served at some point. Is that correct?
Yes, sir, I
Yes, sir,
did.
I
I
did.
did
I did
actually
actually
seven
seven
tours.
tours. 7 tours. Thank you for your service. I hope everybody here who's listening really respects the vulnerability that you're taking and sharing your story because there's a lot that we can all learn from it. Please go ahead.
Okay, so
Okay, so
I have to be
I
honest
have to
with you,
be honest
doctor.
with you,
My
doctor. My
main
main
PTSD
PTSD
issues
issues
are not
are not
so
so
much
much
combat
combat
related
related
as they
as they
are
are
um,
um,
medical
medical
related
related
in
in
civilian life.
civilian life.
Um,
Um,
most
most
severe was
severe
actually
was
just
actually just
recently over the
recently over the
summer,
summer,
where I've
where
had,
I've had
at this point now,
right now
9
nine
lumbar
lumbar
surgeries.
surgeries.
I'm now
I'm now
fused from
fused from
L2 down
L2
to
down to
S1.
S1,
And I had
I
just
had just
finished a
finished a
recovery,
recovery,
which, as you know, takes a
takes
very
a
long
very long
time.
time.
And
And
about a month
about
and
a
a
month
half
and a half
later,
later,
I had another
another
injury, and I
injury,
use
and
that
I
in
use
air
that in air
quotes.
quotes.
Um, Make a long
Make a
story
long story
longer, Doc.
longer, Doc.
Everything had to be
Everything had to be
redone.
redone.
Fusion had to
Fusion
be
had to be
extended,
extended.
and I was in the
I was in the
hospital a
hospital
month.
a month.
Um,
Um,
the whole
the
time
whole
I
time
was
I was
there,
there,
and this has been an
this has been an
ongoing issue
ongoing
for me,
issue for
where
me where
pain
pain
management
management
has always
has
been
always been
difficult for
difficult
me.
for me.
Be
Excuse
it
me,
my
Chris.
yes,
Chris,
yes.
sorry to interrupt you here. I just want to make sure that everyone can hear you. This is a brand new feature that, as you know, is that
Okay,
YouTube is giving us access to, and I've got a bunch of comments here saying there's an echo. I just want everyone who's listening here to let us know where the echo is. I'm going to put my microphone away from my phone speaker, so hopefully it won't echo Chris's voice. But are people having trouble hearing Chris? Because I can hear Chris very well, but I want to make sure everyone else can hear him as well. But you can go ahead, Chris.
okay.
I'm just going to be monitoring the comments to make sure people can hear you.
Yes, sir. I can hear
I
the
can hear
echo
the
on
echo
your
on
end
your
as
end as
well.
well.
Actually, that's a little
That's a
better
little
now.
better now.
Um,
Um,
but my
but
issue,
my issue,
doctor, has
doctor,
been
has
that
been that
pain
pain
management for
management for
me has
me
been
has been
always been
always
very
been very
difficult,
difficult,
to the point
to the point
where
where
gets
gets
very
very
uncomfortable
uncomfortable
to tell a
to tell a
doctor,
doctor
I'm in a lot
I'm
of
in a lot of
pain and
pain
this is
and
what
this is what
helps.
helps.
At least where
At
I
least where
am,
I am,
there's a
there's a
stigma.
stigma.
And in my
In
opinion,
my
I don't
opinion,
think
I
it
don't think it
gets
gets
addressed
addressed
well
well
enough,
enough,
especially by
especially by
my
my
medical
medical
providers that I've
providers that I've
encountered,
encountered,
in terms
in
of
terms of
feeling
feeling
comfortable
comfortable
talking about
talking
pain
about
management.
pain management.
Um,
Um,
you're
you're
immediately
immediately
deemed a drug
deemed a
seeker,
drug seeker,
especially when somebody
especially when
looks at,
somebody looks at,
say, my
say, my
history.
history.
Okay, he's had 9
He's had nine
surgeries,
surgeries,
chronic GI
chronic GI
problems.
problems.
Why does he
Why
need
does he need
so much pain
so much pain
medication all the
medication all the
time?
time?
Um,
um,
but what
but what
to
to,
to bring us
to bring
back
us
kind of
back kind of
to the
to
summer,
the summer,
doctor,
doctor,
I
I
endured
endured
weeks and weeks of insufficient pain management by the pain management teams, by the hospitalists, the APRNs, the PAs. Um, and I think, I don't know how it works by you, doctor, but now it seems like when you're hospitalized, you see everybody but a medical doctor. As I just said, a PA, an APRN, a nurse, of course. Um, and they're basically shift workers at this point. They're not there all day, 24/7, like you yourself may be in a lot of cases. Um, and I notice that they tend not to really care as much because they get off work at 3 and somebody else is assuming care when they leave.
Chris,
Uh,
I'd like to just jump in for a little bit here.
of
Firstly, I want to
of
make sure,
course.
can people hear me? Can you hear me, Chris?
Yes, doctor, I still have you loud and clear.
Good. So, first off, thank you for sharing this story. You are not alone by any means. So many patients who come into the operating room where I'm at right now, right? Many patients come in here. I can't even tell you how many I've had this week alone, where multiple surgeries have changed the chemistry in their brains, and not it's no one's fault. But every time we have a trauma, whether it be a physical trauma like surgery, being cut open, having an injury in a car accident, a bike accident, whatever, or having an emotional trauma, we are fundamentally changing the neuroanatomy in our brain. I hope everyone appreciates that this is not, when we say it's in someone's head, that's true, it's in their head, but being in your head affects your whole body because the mind and body are connected, no question at all. I will have to share some stories next week about what some very challenging cases I had this week alone where the neurochemical changes, the neuroplasticity that we talk about in psychedelics, for example, can harm patients, can increase pain thresholds, can cause them to feel pain in fundamentally different ways than you or I hear. You or I feel. Now, a lot of people here are saying they can't hear me. I hope this isn't problematic. Can you hear me, Chris?
Yeah, I your video is perfect, and I can still hear you perfectly.
Everyone's saying the sound is unstable. Let me just take my microphone away and maybe just pardon here. Let's see if the phone microphone works better. Is that any better?
For me, it's unchanged.
Unchanged? Okay. Well, we'll have to give YouTube feedback, but I want to get this point across because it's very important for everyone like you, Chris. You should not be ashamed. You shouldn't have any. You shouldn't feel bad telling your doctors how you're feeling because how you're feeling is very real, even though it's in your brain. Because pain only exists in our brain. Doesn't mean it's not real, but pain is 100% in the brain. And based off of what you've been describing, every surgery that we have, all the chemicals and the medicines that we give you, I just have one here, for example, but these all cause changes in the brain. They often are not changes that persist for long after the surgery. However, when somebody has repeated surgeries and they have repeated, I don't know if this is your case, but if they have psychological traumas between those surgeries, having inadequate pain relief, having new pain come up, having problems with their social relationships inside outside the hospital, etc. These causes changes that happen from anesthesia and surgery to persist longer, to cause the neuroplasticity to go in what we might call the wrong direction. I'm not saying anything is good or bad, but I'm saying that the neuroplasticity, the rewiring of the brain, goes in a direction that decreases the pain threshold, makes us more sensitive to pain, and makes us feel pain differently. Where the pain medications that typically I give to patients might not work the same. Doesn't mean that your pain perception is wrong, but it means that it's different. And we have to recognize that it's different, and we have to use either different medications or otherwise adjust the neuroplasticity. So I'm curious, you must have at some point been recommended to go to an alternative medicine practitioner, either acupuncture, clinical hypnosis, etc. What has been your experience with that?
Um, Currently, I do go for talk therapy. I do go. I see a nurse practitioner for medication handling, a psychiatric APRN, and I don't remember. I'm not sure if you recall the other day. I was asking you about the EMDR,
Yeah, yeah.
which I'm just starting. So I don't really have any results to report about that. Um, I was referred to pain management at one time, which I declined to do.
Because
For gosh, there's so many reasons, Doc.
give me the top two reasons, if you're comfortable with that, please.
Yeah, number one, it's an unbearable process to even get in the door
Understood.
in terms of paperwork. Um, I don't even know where to keep going with that. And you can't get an appointment
Okay.
for 6 months if you're lucky. And I'm referring, I think I mentioned the facility that I deal with up here, doctor, in Connecticut. I don't want to name it.
You
Um,
mentioned it before. It's a very high, a very prestigious academic university,
yes,
right? Yeah. Starts with a Y. It's in New Haven, Connecticut, for everyone. But I'm not condoning, or you're just sharing a story, Chris. That's perfectly fine. So, because your experience, I can't tell you how many patients have had the same experience, either being blown off, not getting access, and even when they do get that appointment, our conventional way of approaching pain in Western medicine, as you know, there's a reason we're in an opioid epidemic. There's a reason why we have benzodiazepine addictions, etc. Because we try to reduce pain down to a certain chemical, either an opioid receptor, either aberrant serotonin in the brain or the spinal cord. We put patients on all sorts of medications that, if you're comfortable sharing, I'd like to know if you've been on TCAs, if you've been on opioids, benzodiazepines, antidepressants, or like SSRIs. I'm sure you've been on at least one of these in the last 2 years.
yes, sir. I'm still on a benzo,
Mm-hmm.
diazepam, which I take partially for the anxiety, but partially for um, esophageal spasms.
Mm-hmm. Mm-hmm.
So I take that on an ongoing basis and have for years. Um, I have tried, since I've come back from combat, a number of SSRIs that have not helped
Mm-hmm.
at all, to the point where we've stopped experimenting or trying new ones. Um,
If I
I,
could offer here what oftentimes
yeah,
we miss in Western medicine, I know you're well aware of this because I've seen the interactions on the Discord and on the YouTube comments. One of the fallacies that we've adopted in the wrong place in medicine is trying to apply what we call a reductionist view of medicine, like breaking it down into one chemical. We apply that into our daily lives, and that is the problem. And it's not your fault, Chris, absolutely, but we forget the elegance of the human body, of the system that's set up in a way where perturbing one chemical doesn't knock us down because our body pushes back to compensate for that. When we push too hard with a medication, the body pushes back equally. That pushing
understood.
can often lead to many of the side effects that are undesirable and the withdrawal effects or the rebound effects of medications like SSRIs. You mentioned esophageal spasm, but proton pump inhibitors have that classic thing as well, where we're trying to suppress acid production, the body just fights back with a vengeance to overcome that. And that interaction causes friction in our bodies. There's a time and a place for these medications, like in the operating room, when I want to operate on a molecule by molecule basis. But when that's applied to everyday life, it causes much of what you're describing here, where the pain isn't getting better. There's so much to your story that I suspect is leading to these ongoing changes in your brain anatomy and consequently the chemicals that are causing pain or not allowing typical pain relief measures from being effective. And you mentioned anxiety at least once, and you know, as I've seen from your interactions, you know that anxiety changes their pain threshold. You know that depression changes their pain threshold. They work in a cycle together. Have you seen a psychiatrist? If you don't mind me asking.
I have not. I have not.
And I'm not saying you need to see a psychiatrist. I'm not saying you need to do any of these, but one does need to be aware of what happens to our bodies when we have Chris, the mind and body are connected, as you know. When our mind is in pain, our body will adapt some of that pain, will adopt some of that pain to try to relieve the pain of the other, and vice versa. When our body has some pain, our mind will bear some of that brunt. But they hurt each other, not because it's anyone's fault, but because the body is not designed to compensate like that for very long. We can do it for days, minutes, hours, but not for weeks, months, years. From what you've been telling me,
Mm.
this has been years of a struggle. And
Yeah.
I hope that you don't take it as a sign of weakness or as a sign of inadequacy that we're talking about mental health in the context of your pain.
Not at all. Not at all. I fully embrace the mental health aspect of it, and um, I'm a strong advocate for mental health to the extent I can be.
Can you share
So,
one
yeah.
thing that that makes your heart rate go up, or makes your palms sweaty, or makes you feel that you have rapid, shallow breathing, that makes you feel like maybe you have a headache? Is there one experience you feel comfortable sharing with us?
Any experience at all.
If you're, yeah, just share one experience that's happened more than once that gives you those symptoms.
When I hear, I know it may sound silly to some to say, but the facility I was at starts with a Y in New Haven, Connecticut. When I hear that name of that facility, I immediately get very anxious, scared, um, very hyper vigilant, uh, fearful. I mean, there's a host of emotions that go through my mind, doctor, when I hear the name of the facility, just based on eh, eh, and this is also a discussion of standard of care, in my opinion. And there's a clear distinction, I think, between the two in terms of your health and the kind of care you should be receiving. But to answer your initial question, that will trigger those types of emotions.
Chris,
And that's just one example.
thank you for sharing. Even one example is powerful to one demonstrate how incredibly tenacious you are in thinking about it, recognizing that there is a trigger. And I don't mean a trigger in a way that sometimes people make fun of, like, oh, that's triggering me. That's not what we're getting at here. It's talking about what loops are in our bodies and our minds when certain sights, smells, sounds, reading something, hearing something, anything, cause our body to go into a loop, right? I don't care what it is, but that's what we're going to call a trigger, not the sense of like the media when people make fun in politics of triggers. No, recognizing that we have habit loops, and this isn't. I'm not saying it's your fault, Chris, right? But we all have loops that our bodies train into ingraining more and more into. And you've just described one very, very, like, it's a very sad event, of course, but it's a beautiful description of you recognizing what your body is doing. And I got to tell you, Chris, there's no substitute, no doctor, no advanced practitioner, whatever. Nobody can substitute the work that you just did for yourself in explaining to me and a whole bunch of others what that triggers for you, what the source is, what it triggers in your body, and then what the outcome is. The outcome is feeling less than ideal, certainly, right?
Yes, sir.
I would
Yes,
use
sir.
other words, but I'm going to be professional and not use those words.
Fair enough.
Right. Starts with an S and ends with a Y, but we'll leave it at that.
Yeah.
But the more, and I'm not going to solve this for you right now, you know that, but
Yeah.
if we could all focus the most valuable resource we've been endowed with on this planet, which is attention, where we choose to place our attention. If we could all do what you have done for this one example, to begin to reflect on what it is and to find more examples of it, because we all have more than one type of trigger, I guarantee you. Me, you, everyone else on this live right now. But if we can, the first step is to recognize them, then we can act on them. But if we don't recognize what the input is and what the output is and how our body is responding, no psychiatrist, no anesthesia, nobody, no doctor can do that work for anyone. And that's why I need to applaud you for not only sharing in front of everybody, but doing it in the first place, doing that hard lifting work of thinking of what is going on. Now, I have to remind everyone, there's no patient provider thing. You're just sharing your experience. And I'm just commenting on patterns that we see in patients all the time. This is not like a formal medical consultation or anything, Chris. I just want to thank you
Yes.
for sharing a couple very powerful stories here, because I think everybody here stands to benefit from what you just shared. And I know you started off saying it was silly, but it ain't silly at all. Because I got those things, and you have them, and everyone else has them.
Yes, sir.
Can you
Thank you.
share, if you're comfortable, sharing why that trigger causes that effect in your body?
How much time do we have?
Well, I mean, in respect of everyone else's time, let's give it 60 seconds. I think Einstein said if you can't describe something in 5 words, you haven't understood the concept well enough. So,
Yeah.
right, it doesn't have to be long. It can just come from your heart, if you will.
I'm being honest here, doctor, and that's a tough question to answer, quite
Yeah,
honestly.
it is. I put you in the hot seat,
Um,
brother.
you did. You did. Um, I think I tend to come back to. Actually, doctor, can I answer that with another example
Please.
that might make it a little easier to understand? Sort of. I had one neurosurgeon every day who would show up at 4:45 a.m. The only provider who would show up every day for 4.5 weeks to ask me how I was doing. And I mean that literally when I say the only provider. And I got to the point where I wasn't sleeping because I was in so much pain anyway, but I was I set an alarm to see how consistent he was. And every day, consistent as could, to the point where I'd say, "Don't you ever take a day off?" Well, when I left the hospital, I never deleted the alarm. So to this day, months later, that alarm still goes off every morning. And in a way, I can't tell you why I have not shut that alarm off. But as soon as it does go off, I'm in a state of panic because it takes me back to that period of suffering. Is that making any sense to you?
Is it suffering? Is there any sense of reassurance, of trust, of gratitude when it goes up? I'm not blaming, Chris. I'm just asking. Is it really overwhelmed by the panic?
I, I think both two things can be true with this, doctor. I think because that provider was showing up every day at the same time and showing compassion and care, that's a good memory when the alarm goes off. However, when the alarm goes off, I'm taken back to the experience as a whole, which was not pleasant at all. So I think two things can be true in that example, for me at least.
I just had to give one more reminder because I see some comments in here. I can't give any recommendations on what to do or what not to do, Chris. You know, this is not a patient-provider relationship. It's just you sharing and me listening and just applauding you sharing your experience so others know that there is so much shared experience across us, between us, you know, in humanity here. I can't tell you what you should do with that alarm. I can say that gratitude is one of the most powerful emotions that humans have. Me being grateful for you for coming on here and sharing this clearly trouble. I mean, there's no words I can describe. Sharing what you're sharing. It's pretty raw, it's pretty vivid, but it is touching. It's often difficult at the same moment to feel gratitude and something else if our buy-in to the gratitude is to a sufficient degree. I'm not saying you're an ungrateful person, not at all, but I'm sharing that there's some emotions that tend to be relatively mutually exclusive with others. It's a little, I don't want to sound too basic saying that, but I'm hearing some incredibly powerful emotions that fall into the category of mutually exclusive in a positive way. And I just recommend that you explore those more with, hopefully, you will find either a psychiatrist or a therapist or somebody who can help guide you to better embrace what you've already described so clearly. What I tell my patients, and I know people here have heard before, I certainly, and no one else, no other physician or practitioner can really ever treat a patient. We can remove the boundaries we have to healing ourselves. You've already demonstrated from your story how thoughtful and conscientious you are, how vulnerable you are in sharing this, and inspiring others to also be vulnerable, to better reflect on their triggers and their loops and their cognitive distortions that lead us to ultimately suffering. I would want to end by saying that you have so many bright stars, so many shimmers of hope here, and not just like hope in a, you know, oh, it sounds hopeful. No, but like legit ways that these can be built on with the right guidance to help. I don't want to say hijack, but literally hijack the neuroplasticity processes that have gone awry through all these surgeries, all these encounters, to begin to put them in the right direction so they can rewire to reduce the pain. There's a physical component and a psychological component, clearly.
Yes, sir.
And I want you to be empowered to keep searching for that and to not take no for an answer when it comes to addressing the mental or the psychological part to the overall suffering that you've been through.
Yes, sir. If I may quickly, um, right now I feel like I have good support for my mental health. It's just something that, as you know, you cannot just turn off. It's a process, and I'm working through that process. Um, I don't know where ultimately it's going to lead, but I have a good team of support, and that's
It's
key.
it's key, and also what you said is one of the most important parts to any healing process, and that's to have the continued, if you will, remembrance of what our values are, what our meaning is. Patients that have a purpose that they revisit on a continuous basis in the ICU, in critical care settings, they're, in my experience and from what data shows, patients that end up having better outcomes in some metrics, maybe not all. We're all mortal at the end of the day. We can't, you know, cheat death. But in our journey, as we all inevitably march towards death, and I don't want to sound too meta or too philosophical, but very practically speaking, knowing, having confidence in our values and our meaning and purpose, and revisiting that on a frequent basis so we never fall too far from the purpose that we're trying to achieve is one of the most powerful ways to preventing ourselves from falling into cognitive habit loops that might otherwise take over and lead to For example, in the operating room, when patients come in this bed for me, the number of times they tell me, "Oh, doc, I always need more pain medicines than anyone else. I always need more nausea medications." Well, that's a habit loop, right? You're already prophesizing, you're fortune telling the future. Of course, your brain and body are connected, and you're priming your body to experience that. When we have strong remembrances or strong, if you will, ways of returning back to our values, we can sometimes prevent ourselves from falling into those habit loops in the first place. That's the whole concept.
Mm.
That's the premise behind mindfulness, which is what I'll talk about in a future live stream. But I'm really happy to hear that you have that support, and I hope that you have an internal way of constantly revisiting, so we never fall far from the path that we're trying to follow. And of course, revisiting the meaning behind that path. But this is why SSRIs are dosed every day, if you will. I mean, for many reasons, but we have to constantly be pushing the chemicals in our brain, increase and adjust serotonin levels to prevent them from falling back to where they were before. Well, obviously, those medications don't work very well. They don't, and they should not be used for indefinite periods of time, if at all possible. But if we're going to replace those, we need to similarly have internal thought processes and a foundation to constantly be helping the biochemical makeup in our brains also be in a healthy balance if we're not using the medications to accomplish that. I hope that makes sense.
Right.
And I hope that you you appreciate just how powerful that support system that you have is in your healing
I
journey.
do. I do. Yes. Thank you.
I just wish you the best, Chris, for coming on here, inspiring so many others to know that they're not alone and they can also find hopefully more dignity from the people trying to heal them. I wish you were in California and we actually could have a formal relationship, like a patient provider
Likewise.
relationship. You know what I mean, right? But I hope that what we've shared here helps you in your journey, and I hope you've seen how many positive feedback remarks you've gotten here in the chat.
Yes.
It
Thank
really,
you to
really
everybody.
does.
I appreciate it.
Chris, there's so much more to talk about. Maybe in a future live stream we can talk about how the neuroplasticity works and what are other ways of adjusting that. But for now, I'm going to let you go and thank you again for coming on here.
Yes, sir. And thank you for your kind and helpful words.
You have more power over your health, Chris, as you've I'm sure heard me say before. You have more power than you've probably ever been told. Um, I'll just end by one of my favorite quotes is by the Persian poet Hafez. It goes along the lines of, "I wish I could show you when you feel helpless or when you're in the darkest spots, that brilliant light shining within you." And obviously, I don't know everything about you. We're just having a conversation here, but if you're like any other human being on the planet, which you are, Chris, we do have an incredible inner healing potential that can be tapped when our environment primes it. If you got to water a plant for it to grow, with this type of continued intention, you're already putting your intention and your attention in the right place. That's how you can
Yes,
let
sir.
your inner healing potential help guide you through this and open the doors to ways of healing yourself that you probably never knew possible. So I just applaud you for everything that you've shared so far. Thank you.
Thank you, Doctor. It was my pleasure.
Until next time, Chris, thank you.
Okay, Doc. We'll talk soon.